The Healthcare Fraud Prevention Partnership, or HFPP, created in 2012, brings the public and private sectors together to combat fraudulent, abusive, and wasteful healthcare spending. HFPP organizations include private health insurance plans, federal agencies, state and local agencies, law enforcement organizations, and healthcare anti-fraud associations. An executive board comprised of member organizations provides strategic direction for the HFPP. The Centers for Medicare and Medicaid Services is a partner and also sponsors HFPP's activities. The partnership has grown to more than 200 members. The HFPP is a leader in proactively identifying and reducing fraud, waste, and abuse across the healthcare sector through collaboration, data and information sharing, and cross-payer studies. The HFPP is unique in its goals and offerings. It is the only partnership with a national scope where public and private organizations are combining their healthcare claims data for enhanced analytics. Partners gain heightened insights into potential fraud, waste, and abuse schemes not visible when looking at just their own claims. Through data sharing, analytics, and information sharing sessions or events, partners are informed of suspicious healthcare claims and fraud schemes. Data sharing partners send data to a trusted third party, or TTP, which has the ability to analyze data across multiple payers, including CMS, to identify potential schemes. HFPP partners who share data will receive study results which can identify potential vulnerabilities that may otherwise have been unknown. The TTP ensures the confidentiality and security of partner data. No partner, public or private, has access to any other partner data. Collaboration and information sharing are key benefits offered by the HFPP to private payers and associations and to public partners, including law enforcement and state and federal agencies. Partners share best practices, identify case leads, discuss study results, and develop valuable professional relationships at both in-person and virtual HFPP events, such as information sharing sessions and webinars. Data sharing is not required for partners to be eligible for participation in HFPP events. HFPP studies deliver unique cross-payer analyses of healthcare claims data. Partners can participate in and have access to HFPP studies and can inform study criteria and design for maximum impact in addressing emerging trends. The partnership provides critical communication tools, allowing for the sharing of trends in the national fight against healthcare fraud. HFPP studies provide insight into fraud, waste, and abuse using a rich and robust cross-payer data set. Partners contributing claims data receive customized reports, as well as aggregated information based on consolidated data. HFPP studies offer visibility into existing and emerging schemes, which can lead to actionable outcomes, including recovery of funds. There are 3 stages of the studies that the TTP conducts. These stages are collecting data, conducting the study, and producing results. Stage 1 is collecting data. The HFPP offers our partners a unique opportunity to participate in data sharing in support of critical studies. Enhanced data analytics stemming from partner data sharing is one of the most valuable aspects of joining the HFPP. All partner data is warehoused by the TTP for absolute privacy and security. Controls are in place to protect sensitive information and are continuously monitored against potential vulnerabilities. The HFPP enhances anti-fraud information sharing by combining claims data from both the public and private payers. Stage 2 is conducting the study. The TTP focuses on current or emerging fraud, waste, and abuse trends that are of interest to our partners. Study ideas are recommended by and designed through crowdsourcing among HFPP partners. Past studies have looked at deactivated providers, urine drug testing, genetic testing, and billing for improbable days across several different types of services. Stage 3 is producing results. Partners who share data receive a customized study report specific to their organization. They also get an anonymized, consolidated report with the aggregate findings from all shared data. The HFPP helps data sharing partners to collaborate on study outcomes and actionable results. Partners who do not share data have access to a high-level summary with aggregate data points. Partners use study results in a variety of ways, including conducting their own investigations to validate results, identifying potential vulnerabilities, or vetting leads and subsequently making referrals to law enforcement. Engaging with the Healthcare Fraud Prevention Partnership is an opportunity to meaningfully contribute to the fight against healthcare fraud, waste, and abuse. By providing the opportunity for increased collaboration and networking, the HFPP helps partners leverage their collective experiences and data to better combat healthcare fraud across the nation. There is no cost to join and participate in the partnership, including sponsored events, studies, or activities, with the exception of any travel costs incurred with in-person events. The HFPP is making great strides in combating healthcare fraud, waste, and abuse. The more organizations that are active in the partnership, the greater the impact we can have together. To learn more, please visit hfpp.cms.gov, paid for by the U.S. Department of Health and Human Services.